I think my audio is off too. And yes, the camera is off.
Cartwheel's a great partner and they want to go to bat for us in a budgeting process and run a really
All right, good morning, everyone. My name is Melinda Southard, and I serve as the Deputy Director here at the Nevada Health Authority for Community Engagement and Workforce Development. And I just want to take a moment to welcome you all to today's public workshop on the Rural Health Transformation Program. So just want to say thank you all so much for being here with us on this wintry morning. And we're going to go ahead and get started with our agenda. So first, I would like to call for public comment. So no action may be taken under a matter raised under public comment unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person, and persons making public comment will be asked to begin by stating their name for the record. And I would like to call and see if there's any public comment. Please use the raise hand feature if you would like to raise public comment on Teams. Okay, and with that, I am going to now turn it over to the leadership for our Nevada Rural Health Transformation Program, Dina Schmidt and Jason Blake. And so Dina and Jason, please feel free to take it away.
Thank you, Melinda, and good morning to everyone. Hope everyone is safe and warm this wintry day as we're dealing with a lot of snow and icy conditions here in the north. I'm Jason Blake. I'm a new agency manager for the Nevada Health Authority, and I have a responsibility dealing with the Rural Health Transformation Program here in Nevada. There's been 4 of us working on this to this point. We're hoping to bring on more really soon. Of course, our Deputy Director, Melinda Southard, she needs to be recognized for her good work in what's been done at this point. Also, Dina Schmidt is our program chief, and she comes with many years of experience here in the state system and great wisdom in managing and working through a grant project like this. The 4th in our quartet right now is Alicia Roman. I don't think she's here today. She may be online, but she is our fiscal lead over the program and also comes with great experience in the state structures so that we can move this program forward in a good way. With that introduction, we'll jump right into it. So today, our agenda is as follows, and we scheduled for an hour and a half. If we don't use all that hour and a half, that's just fine.
Thank you.
We'll give you back some time at the end if possible. But first, we'll go over a quick overview of the Rural Health Transformation Program. Then we'll follow with 4 strategic priorities, subrecipients and contractors. We'll look at focus areas for the year, and then we'll try to address questions and have some discussion at the end as we get there. So this is old news, and I'll go through it pretty quickly. But the Rural Health Transformation Program is a product of the One Big Beautiful Bill Act that was enacted on July 4th, 2025. It is a federal grant program that put forward $50 billion over the course of 5 years. The program is intended to make investments into rural health and lead to truly sustainable transformation of healthcare in rural areas. Focus on this is truly sustainable, and it's focused in the rural areas. And that's what our job is, conducting this program, is to make sure that it accomplishes that. Now, these $50 billion, they're awarded, and all 50 states had the opportunity to receive some of this award. 50% of the award is based on baseline funding. The other 50% is on workload funding. All 50 states submitted applications, and all 50 states were awarded a certain amount of funding for this program. So our application went in, our initial application went in requesting $200 million. We received our notice of award that gave us $179,931,608. There are 42 cents there, but they've, I guess they just fall off, I guess. But I see that every time I see the 42 cents there. But so each state was awarded, but none of the states, to my recollection and my knowledge, were awarded the $200 million flat. And so every state was given a different amount, and so every state had to submit a revised budget to CMS. And our budget has been submitted, and we're still awaiting their final approval on that budget. One thing to note here is that this is a 5-year program. Each year, we at the state will have to submit a non-competitive continuation application to receive the funding going forward. And that application will be submitted along with annual reporting. Now, this next slide is important. One of the most difficult things for me is there's so many deadlines floating around. And we've got our state fiscal years, we've got the federal fiscal year, we've got budget periods, we've got reporting periods, and it seems like none of them jive together. And so this is an important visual. And I encourage you to take some time and to see how it fits with all the schedules of the state and the federal government. Key piece here is there's 5 budget periods. This first budget period began December 29th of 2025, and it will end October 30th, 2026. But the spending for the budget period can go through September 30th of 2027. So you can see even I messed up there and I practiced over and over. And I apologize for that, but please take a look at this graphic to make sure the years are understood. Key piece in this as well is September 30th is when those funds have to be spent each of those years. We'll move now to the strategic priorities. For the Nevada application, we focused on 4 strategic initiatives, and they are as follows: the Rural Health Outcomes Accelerator Program, the Flex Fund to strengthen rural health infrastructure, workforce recruitment and rural access program, and finally, the Rural Health Innovation and Technology. I'll go back through these with a little bit more detail, but Dina here shortly will go into a lot more detail and may answer some questions that may be floating around. So the Rural Health Outcome Accelerator Program, we refer to it as the ROPE, is evidence-based outcome-driven initiatives. Looking at some of the chronic illnesses and diseases, looking for prevention and management practices to improve the outcomes, looking at behavioral health, prenatal care, and that's just to mention a few. There are many other illnesses and diseases that need to be confronted, and through this ROPE program, we hope to see improvement in outcomes. Next is the Flex Fund to strengthen rural health infrastructure. We just refer to it as the Flex Fund. This is for rural hospitals and clinics for their infrastructure needs. We hope that those applying for these monies will leverage regional buying power and regional purchasing strategies. We hope to find the best bang for the buck as there's collaboration among the different entities here in the state. There can be no shared resources and no new construction. The construction piece has been interesting. We can't do new construction. There's some renovation that can be done if it's done appropriately and as approved by the state and also by CMS. The next bucket is the Workforce Recruitment and Rural Access Program. We refer to this as the RAP. This is for recruitment and retention of providers and healthcare staff. We're supporting and we hope to see initiatives going forward to grow your own pipeline of employees. We look at tuition and training support. It lists here CCW, CHRS, PSS. Those aren't the only things that we're looking at. The community health workers are important. The peer support specialists are important, but there's also other needs. We recognize CNAs and medical technologists and MAs in the clinics. So we hope that some of those priorities will come forward. We hope that they'll also address burnout, isolation, and retention needs. And there's opportunities for incentives for new rural providers. And of course, one of the biggest portions of this program is we're hoping to build and see a rural residency program come to the state and stay strong to support the rural areas. The final area is the RHIT, or the Rural Health Information and Technology. This is for enhancing the digital health ecosystem in rural Nevada. If you have questions about that, it's pretty detailed on the CMS website, and in some of our information that we've put out, there's a link directly to the digital health ecosystem that CMS is promoting. We hope to see improvements in rural telehealth infrastructure. And then, of course, improved access to patient-centered care and interoperable health data sharing systems. This is a quick breakdown of those 4 initiatives and the amount of monies that has been put forward in those 4 initiatives. So in the ROPE, there's 15%, or that just under $27 million. In the Flex Fund is 20% of our total award, just under $36 million. And then there's the RAP, which is 40% of our funding, at just shy of $72 million. And then the 4th initiative, the RHIT, is 15% also, just under $27 million. Some other initiatives that are written into our budget and into our project narrative is to help and support our rural veterans. And so there is $2,384,094 for the Nevada Division of Veteran Services. They'll be utilizing that. There's that equal amount for rural corrections. And then we have a set aside for the rural tribal health of just over $8 million. And then there's a push to bring in the presidential fitness test. And we've allocated $1.3 million to introduce and get that project up and running. So these are the funding priorities, where the money is going. And at this point, I'll turn the presentation over to Dina to go into a little bit more detail on the initiatives.
Good morning, everybody, and thanks for being here. So let's talk a little bit about the Rural Health Outcome Accelerator Program. We do have about $26.9 million set aside for budget period 1. And this is really intended to fund evidence-based initiatives, focusing on chronic disease, primary care, behavioral health services, and maternal and infant health, specifically really trying to improve prenatal care as well as health outcomes for mothers and children. So the funds will be distributed in coordination with the Nevada Department of Purchasing. We will be creating a request for proposals, so an RFP for these funds. These are slated to be released roughly May of this year, so May of 2026. A couple of examples and goals, we wanted to kind of just talk through some things that we're looking for and some ideas of strategies that we would expect to see in this program. So financial incentives, rewarding hospitals and rural providers for participating in value-based payment arrangements. We really would like to see an increase in participation in those types of arrangements. Creating integrated care models, so looking at leveraging non-traditional healthcare workforce, formally integrating certified community health workers and peer support specialists into the care teams, possibly expanding the scope of partnerships with county health departments and FQHCs as a way to better deliver behavioral health and maternal health. In this area, the ROPE program, priority will be given to proposals that promote collaborative care models. So we're really looking for models that connect families to diverse resources and community supports, especially those that work with children in the foster care system or children with serious emotional disorders who live in rural areas. Keep in mind, across all of these fundings, there is a 10% cap on all RHT funding. for administrative costs, that it does include both direct and indirect. And we will get into more specific uses of funds, but I just wanted to call that out as you're thinking through your projects in this area. And the next funding opportunity is our Flex Fund for rural providers. This really is a focus, $35.9 million in budget period 1, focused on capital improvement and infrastructure costs that support innovative technologies and promote more efficient care delivery and better access to care in the rural areas. These funds will be distributed through a request for application, an RFA, which is slated to be released in March. We're going for March. We're aggressively trying to get these out the door. So that RFA should be released in March. It will be an open application process through August of 28th, or until all the funds are distributed. Some areas that we'd like to see proposals come through in this area, some ideas are emerging technologies such as advanced telemedicine platforms, AI-enabled clinical tools, telehealth and remote care, things like telehealth rooms or suites or mobile telehealth carts. These funds could be used for mobile health units such as vans, mobile imaging, mobile dental units, mobile behavioral health units. They can also be used for diagnostic and treatment equipment, so digital X-ray systems, ultrasound machines, things of that nature. It can also be used for some cybersecurity and data infrastructure for upgrades to the network if needed, and certain cybersecurity tools and training. One thing to keep note of in this program, as well as the IT program, broadband infrastructure is not an allowable cost under this program. And then these funds can also be used for minor facility alterations. While there is no new construction allowed, some alterations that are related to program goals can be approved. They do require CMS approval. As Jason mentioned, this is a 5-year cooperative agreement with CMS, which means CMS is highly involved, and a lot of our proposals will have to go back to CMS for approval before we are allowed to fund certain programs. The next one, Workforce Recruitment and Rural Access Program. This is $71.9 million available in budget period 1, really focused on retaining physicians and clinicians and a wide variety of other healthcare providers throughout the rural area. There is a strong preference for awards related to financial incentives and training programs that are given to rural hospitals and healthcare providers that operate in the rural counties, such as our certified community behavioral health centers, federally qualified health centers, primary care, behavioral health care, school-based services, and other health clinics in the rural communities. All funds distributed under these projects for incentives for providers must come with a tied to a 5-year rural commitment. So individuals receiving funds, incentives through these programs have to commit to working in the rural area for 5 years. These funds will be distributed through both an RFP and an RFA. So we're focused on a couple areas. One area is focused on rural medical residency program, which will be an RFP. And that program, we're slated to release the RFP in May of 26. The next area of focus is workforce provider recruitment and retention. That funding will be released through an RFA and is slated for release in April. And then lastly is rural workforce focused on provider training and apprenticeship programs, really trying to look at how do we recruit and retain and incentivize those providers that we already have. Those funds will also be issued through a request for application, so an RFA, which is slated to be released in April of 26. So under the medical residency program, we're really just looking to create or expand current rural medical residency programs throughout rural Nevada. Under provider recruitment and retention, we're really looking for the funds can be used to incentivize providing new hires in rural areas. They can focus on we really would like to see a focus on high need provider types, those that are where there's a service gap. We're really looking to see ideas around how do we fill those gaps in our rural areas. And provider training and apprenticeship programs, really looking for, again, those programs that support the providers, increase their retention, prevent burnout. We know we see a lot of burnout in the rural areas, and so ideas around training programs to prevent that and support those providers that we do have. Initiatives could also include things like grow your own pipeline, collaborations with local high schools on building your own high school to career pathways, and local training programs that incentivize local workforce recruitment. And the last area is the rural health innovation and technology. There's $26.9 million slated in budget period 1. And this is really a fund that's for technology solutions that help fill the gaps in our rural service areas. These funds will be issued through an RFP, which is slated for release in May of 26. Some examples and ideas we're looking for in this initiative is health information technology modernization. So electronic health record modernizations, things like remote patient monitoring tools, cybersecurity systems, and software and technology that go with and prevent chronic disease.
You're back now, Dina.
Can you guys hear us?
Yes, we can hear you now. Did you lose us?
I don't know.
Text message.
Can we log out, log back in?
Testing, testing. Dina and Jason, can you hear us? Okay, folks, it looks like we're having a few technical difficulties, and the presenters have logged out and will be logging back in momentarily. Thank you so much for your patience as we work through this. We are watching the chat as well for your questions, and there will be another public comment period at the end of the presentation.
Thanks, Monica.
I have to do this one too.
We briefly lost internet, so stay tuned.
We
Always
can
fun.
see you and hear you. It looks like Jason and Dina.
Can you all hear us?
We can hear you. Can you hear us?
Yes. Sorry about that. I had to get the tech guru here.
Or the guy who's running the push steps at the work.
Sorry about that. This is our biggest fear. Both Dina and I, we're all prepared and we have all our remarks ready, but we can't control the digital stuff. So we'll get the program back up, or the presentation. Melinda, did you tell any jokes while we were off?
No jokes, Jason.
I thought for sure you'd be rolling with some good comedy relief there.
Okay, sorry about that. And why is this not showing? Let's see, you guys can't see. What slide are you guys seeing? Mine shows that it's,
Dina, I'm seeing page 1.
oh, darn it. Okay, give me 1 sec. I apologize. For some reason, it's not syncing to my slideshow. I'm showing slide 14, but none of you can see slide 14, I'm guessing.
No, unfortunately, it's stuck on page 1.
Ah,
Need to get that IT guru back in.
he just went to grab him for me. Oh,
Oh,
there
there
we
we
go.
go.
That's still not going forward.
We're on
Uh-huh.
slide 4.
We're making progress.
Yep.
Now our slide presentation will.
It'll let me go forward.
Okay, we're on 14.
Slowly, that's slower than this,
Okay.
which is really weird.
Okay.
All right, there we go.
Sorry.
We made it. Nope, thanks, you guys. Sorry again. Technology's my. Okay, so. Under the health technology, I was giving some examples. We talked about some consumer facing tools, health products that prevent and manage chronic diseases. Looking for digital health innovation, so some care navigation tools or potentials, things like infrastructure such as symptom checking and triaging, remote triaging. This could also include things like analytic tools, so real-time population health analytics that help improve systems across rural Nevada. Could also include standardization of clinical data exchange and pharmacy automation systems. And again, just a reminder, in these programs, broadband infrastructure is not an allowable cost under the Rural Health Transformation Program. So some subrecipient information. For some reason, there's a delay between my screen and your screen, so I apologize. It's going to take a minute. Wanted to go over some information about the funding under this Rural Health Transformation Program. So in addition to CMS's normal rules at 2 CFR 200 that many of you may be familiar with, if not, we have some links on our website to more information regarding allowable uses of federal funds. But in addition to those normal federal funding limitations, the Rural Health Transformation Funds has some additional unallowable costs. So new construction is one that is not allowable. Any funding for construction that adds value, substantial value to a facility is not allowable. We cannot supplant funds for anything that was in process and already being constructed. Also for replacing a payment for clinical services that are reimbursable. So we cannot pay for services that are reimbursable under any provider type. There's also limitations on direct clinician salaries and supports for facilities that subject clinicians to non-compete contractual limitations. Funds cannot be used. This one is going to be a difficult one, and as far as managing and tracking and making sure that we're all aware, we cannot supplant any existing state, local, tribal, or private funding that's already in place. This includes things where that are already existing and already in place. You cannot replace those funds with RHT funds and move those to other. So if you have funds slated for a project, they have to remain in place, and these cannot replace those. The funds can also not be used for services or equipment or any type of support that are the legal responsibility of either a state entity, a tribal organization. For example, the schools district, if they are obligated to provide a service legally, these funds cannot be replacing those services. Some more important information for subrecipients and contractors, just a general reminder. If you have not registered with the Nevada Business License, you will be required to have that in place before funding can be approved, as well as being a registered vendor with the state of Nevada and having your own unique ID. So there's links here. We will also have these links on our website for more information for those that may or may not have already gone through that process. Grantees will be required to submit quarterly reports. as well as quarterly requests for reimbursement. So this is like most grants, this is a reimbursement-based process. So quarterly reimbursements, annual and quarterly reporting. And just a reminder too, I think there'll be a question is you can apply for funding under more than one initiative. So if you receive funding under the ROPE program, you can also apply for and receive funding under the FLEX program. They will be managed as separate grants. And with that, I will turn the presentation back over to Jason.
Thank you, Dina, and great work even with our technical difficulties. The next area that I want to go over briefly is our next steps in the RHT program. I'm hoping the visual will come up quickly.
It's got a delay, but it'll be there.
All right, here it is. So some of our next steps along the right-hand side of the page there, February through March, we are trying to do some public workshops. We have this one today. We also have another one scheduled on March 5th. And we may have more depending on needs that we see out there. We've also been doing some workshops for individual groups. And if there are some groups that have not heard our song and dance, and would like to have us present something to you as a group or as a consortium, please reach out to us and let us know. Right now, we are awaiting the governor's approval for our steering committee. We went through 96 applications, and we seek to put in place a steering committee of 15 people representing different areas and professions, and we're looking forward to receiving that approval. Our first steering committee meeting will be March 11th at 1 p.m. The agenda is being generated and will come out shortly. The quartet that we have has been wonderful, but we also look forward to adding some staff to help us along. In my feeling, this is a big bus, and we've gotten it rolling. And if we don't get some staff on board to help us, we may be under the tires before long. And so we're eager to bring on some staff, and we hope that will take place over the next couple of weeks. Now, in March of 2026, next month, we intend to release the RFAs for subawards for the rural, veterans, corrections, tribal, and flex initiatives. And so be looking for that here in March. We'll make sure everyone's notified of that. The RFA applications for year one funds accepted continuously through August 28th, 2026. So it will be an open window from the time that the RFAs come out. Oh, now I'm getting feedback somehow. But when the RFAs come out in March, that window of opportunity is open through August 28, 2026. We will have to have all the funds obligated by that time. And then all funds, like I stated earlier, will have to be spent by September 30th, 2027. So you have this first period is shorter. The last item on that right-hand side is RFPs for contracts and RFAs for the 4 primary RHT initiatives come out April through May of 2026. And so be looking for those. Another item that's not on there is that we already have to start preparing and planning for our annual reports and our non-competitive continuation applications. So while all this work is going forward, we will have to put our eye towards the future, making sure that we're reporting accurately and appropriately and preparing for next year with our application. One thing that I wanted to talk about really quick, just as I was talking about reports, each entity that receives funding through this program will also have an obligation and a requirement to provide reports and to actively participate in the reporting process. Reports have to be quantitative as well as qualitative. And in order for us to maintain this level of funding, or maybe even more through the future, it relies on our ability to report accurately and on time with good information. So for those that are planning to apply in a RFP or RFA, please be prepared and have thought processes towards your reporting. Sustainability is another key piece. Funding needs to, or programs produced or brought into place because of this funding needs to be sustainable. We do not want any fiscal cliffs at the end of 5 years where a great program fizzles because there's no longer funding in the future. So please pay attention in that area. I think in closing, over here on the left, underneath the beautiful picture of Nevada's desert, deadlines, all year one RHT funds must be obligated by October 30th. So that's on us to put together that process. And then they must be spent by September 30th of 2027. Now, funds in budget period number 2 will have to be spent by September 30 of 2028. So it just rolls 1 year forward each time. In this first year, it's a shortened time period, so I encourage everyone to consider the time period. If there are proposals coming forward in a phased proposal or program, look at this first phase as one that is maybe shorter and can be handled within that period. Melinda, you have a question?
Sorry, thank you, Jason. I just wanted to offer a quick clarification because I noticed that in trying to make sure that everything is absolutely correct on these slides, we mistakenly overlooked a date. So that obligation date, all year one RHT funds have to be obligated by October 1st, not October 30th. So we have to get all of those, contracts and subawards all executed by October 1st of 2026 to meet that obligation date. So we'll fix that in the slides moving forward, but just wanted to offer that clarification for folks. Thanks.
Thank you. Our terrible nemesis, dates and timelines. There's too many of them. But thank you for that correction, Melinda. The final piece down there on the bottom left is important, really important. I hope everyone takes note of these resources. We're in the process of getting approval on an updated website with a whole bunch of great information, and our goal is to keep it updated with new and entertaining and exciting things. So make sure you're keeping track of the RHT website. Also, and there will be a link to the meetings website on our RHT website, but keep track of our meetings. Any meeting that we conduct will be listed on there. Any public meeting will be listed on there. Sign up for the listserv. I know that many of you have already done so. Those that have not, please sign up for the listserv. When we push out RFAs and RFPs, they will go out along on the website, also in the listserv, to notify as many people as possible. And then if you have further questions or needs or thoughts and ideas for us, please reach out to us at the rhtp@nbha.nv.gov website or a email address so that we can address your needs. Before we go to the contact information, I have received a lot of questions from public and people from around the country that are easily answered through reading the NOFO, the Notice of Funding Opportunity, or through the frequently asked questions that are put out by CMS. And so we do have links to both of those resources on our website and would encourage everyone to look at those. They answer a lot of the questions that we've been asked, and we love answering questions, but sometimes those will give a better answer than I can offer. And so that's the end of our little presentation. As you can see, here's our contact information. Please feel free to reach out to us and ask us or share anything that you have. With that, I think we'll open up for questions and discussion. Melinda's online so that she can help us with this, and we'll do the best we can. Are there any questions?
Jason, this is Monica. There were several questions in the chat, but it appears that Melinda was able to answer all of them.
Melinda here, awesome.
Just trying to keep up with you guys.
Are there any questions? We don't want to leave this opportunity without addressing what we can. Okay, hearing none. Monica, are there any other questions unanswered on the chat?
Yes, two just came in. The first question says, will you be putting out a preferred vendor list?
I can take that one. We are not planning on putting out a preferred vendor list. We are planning on putting out the request for proposals, which will be run through Nevada State Purchasing Division through Nevada ePro. So the links that we shared earlier in the slide presentation will help you to become, a Nevada approved vendor so that you can be prepared to apply through those opportunities.
Thank you, Melinda. The next question says, do we need to create an account for RFA/RFPs?
So that should be also the Nevada, you want to have your Nevada vendor ID number. And those links were shared earlier in the presentation, which we will get these slides out and posted on our website as soon as possible after this webinar. But those links will help you to be ready to have all that information, so you don't have to worry about, say you applied for something and you were awarded, but then you still need to get your vendor ID. So we can't, execute a subaward or a contract without a Nevada vendor ID and all of that good stuff.
Next question. What bucket would patient telehealth training best fall into?
Jason or Dina, do you want to take that one?
Well, my first stab would be in the wrap, where there's opportunities for training opportunities in there. If it was a brand new program that you were just standing up, there could be some infrastructure needs. It could be a flex piece, but my first thought would be in the wrap side of the initiatives and work through that RFA process.
I would also like to offer potentially the rural health innovation and technology bucket could potentially be that as well.
Thank you. The next question, is an LOI needed or solely focused on RFA, RFP?
I'm not sure this is Dina, and I'm not sure what an LOI would be needed for. This is solely an RFA and RFP process for these funds to be distributed.
Thank you, Dina. The next question, if we create a mobile team to provide behavioral services, would mileage to get to different locations be paid?
I think that you could include that in your proposal, in your request. Of course, we have to follow, the GSA rates for everything. So, any mileage reimbursement would have to be requested under the GSA rate, but, I would say you could include that in your, application or your proposal.
This is Dina, and I would just add that you should also make sure you're including how you're going to sustain the program beyond this funding period. So if the mileage is needed initially to get the program up and running, it could be allowable, but we would certainly want to see information about how you intend to sustain that program beyond the 5-year.
Thank you. Next question. Can you clarify what type of equipment is allowable, i.e. CT, MRI, mammo, etc.?
Sure, I think that any of those pieces of equipment could fit into this, especially if you're upgrading your service from 16 slice CT to whatever the next level you want to go to, so that can improve diagnosis opportunities. Definitely mammography, if it's new equipment, new services. Yes, if it can be tied to improving the healthcare infrastructure and the healthcare to the patients, it can definitely be considered and move forward.
Okay, and it looks like we have one last question in the chat right now. When will the FFPs, RFAs open up for the innovation and technology strategic priority?
So the Rural Health Innovation and Technology, that one is scheduled for an RFP to be released in May of 26. So this May.
Oh, and I see, sorry, Monica, I stole your thunder. I see the last one. I got excited.
Go ahead.
So when applying for any of the grants, can multiple organizations collaborate and apply under one RFA or one RFP? Yes, absolutely. We are looking for a high level of collaboration and partnership across our, rural areas of the state, and, looking for also that cross collaboration between, rural and urban, because, we have a lot of resources in our urban areas that can help to, enhance healthcare in our rural areas. So yes, 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 yes.
There is one more question that just popped up. What is going to be the definition of rural?
So for that one, in our application, we had to use I believe it was the HRSA definition for rural, which includes all the counties except for Washoe, Clark, and I believe Carson City. However, that does not exclude those counties from, collaborating with partners and working with folks who are in rural counties to be able to apply for these funds.
Okay, I do not see anything in the chat that we have not addressed.
All right. Well,
one more question just popped in. I'm sorry, Jason. Do you have to reside in Nevada to apply for the RFAs or RFPs?
These, I would say, like, I'll start it, and then Jason and Dina, if you want to pop in, I would just say that these funds are intended to support rural Nevada. So all of the rural health transformation funds that were awarded to Nevada need to stay in Nevada.
I think that covered it.
Okay. And Nicole, if you do have any more questions, just reach out to the emails that you see on your screen. But I do not see any hands raised or any other questions in the chat right now.
Excellent. With Jason,
Just
if you mind,
kidding.
I'll just move on to public comment really fast. So public comment regarding any other issue. So again, no action may be taken under a matter raised under public comment unless the matter itself has been specifically included as an agenda or on an agenda as an action item. So I just wanted to call for any other public comment.
Melinda, this is Monica. It looks like I may have missed a question. And Ryan, I appreciate you throwing that to the bottom of the chat. There was a question that says that are entities that are not located in HRSA rural designated areas eligible if they provide services in rural areas? For example, a hospital in Pahrump that provides healthcare services to rural residents.
Yes. On that one, you just have to provide that justification in your application or your proposal. So be sure to heavily justify, the population that you serve and how it meets the rural definition, even though the county itself, isn't technically a HRSA designated rural county. I think that about wraps us up. Well, I again, thank you all so much for your time today. Really appreciate it. And we'll see you on the next one.
Thanks.
Thank you.